Closet podcast. I am Dr. Sam, and with me, as always, Dr. Robert. How are you?
Good. How you doing this morning, Sam?
I'm doing really good. It's my day off, so I'm kind of chilling here. I mean, really, what I'm doing is actually cleaning my house because my day off just means I have to catch up on all the things that I didn't do all week. So
Yep.
that's what I was doing this morning.
Honestly, being an adult sucks because like your days off are not really days off anymore. They're like days to
Yeah,
catch up on like normal life activities.
yeah.
And so I
That you
was doing
don't
that.
have time to do on the days you work because you are working all day and then come home with like records to do. And yeah,
Yep,
I'd have days
exactly.
for me. Yeah.
Yep, love it. It's really great. So welcome to adulthood. It's the
Yeah.
worst.
Yeah, exactly.
And I feel like social media knows that I have this concern because now like every meme that I get is targeted towards being like an adult and
And
how like
adulting.
now. And I'm
Yeah.
like, this is great. Thanks, guys. Really appreciate the positivity I'm getting from this.
Yeah, yeah. You're like, well, at least I know that I'm not alone and other people feel overwhelmed by their lives.
Yes. It's like group, we're all in it together, guys. Enjoy
Yeah,
it. So,
exactly. Exactly.
well,
So I thought of like a topic today based on a case that I saw. And I feel like whenever we have inspiration from life, it's kind of nice to see how I see these things and then how you see these things, kind of get back to our roots about like how we kind of come at the podcast. So I thought we would talk about ascites today.
I think study is a great topic. It's one, it's a lot to do with it, and it is very
Yeah.
different. I think it's different how it presents, I think, for the two of us. So I think
Yeah.
it's nice to go over that. So yeah, I'm excited.
Yeah.
Excited.
Ascites. So I guess the first thing we should do is maybe talk about what that is for people who have never heard that term before. Would you like to explain what ascites is?
Yeah, essentially, it's just the point where you have fluid in your abdomen that doesn't belong there. And when we say in our abdomen, it's not like in your stomach, it's not in your small intestines, it's surrounding the organs that make up your abdomen. And I think that's really important distinction because everybody's like, oh, yeah, I think his stomach's really big, or like, yeah, I thought that's what's going on. I'm like, no, it's actually fluid around the organs,
Around.
not.
Yeah, yeah. I know. In fact, in this particular case, that sort of was the inspiration for today. We were having this conversation, and I actually thought I had explained it well, but
Yeah.
then found out that no, I did not because they said, oh well, when he had diarrhea, which I'll give you the all the information, but he's like, well, when he had diarrhea, there wasn't any blood in it, and I was like, right, but this isn't in the GI tract. This is
Yep.
around the GI tract, and so I think it always reminds you a little bit that sometimes our knowledge we just take for granted when we say certain things. Even when you try to say them in ways that are not medical, they can be really, really confusing. And so I'll give you the background of this particular case. This just really sweet old kind of shepherd lab mix, about 13-year-old male neutered guy.
Yep.
Had this sort of like, it wasn't a very clear cut history of like this is going on or that's going on. It was sort of like, well, he usually really loves to eat and he's sort of like eating less. And
Yep.
that's been sort of going on over the last couple of weeks. And he it's weird, like, he never throws up, but like a couple of times, he threw up, but we thought he just drank too fast, or they kept chalking it up to different things. They were like, it's just weird, like it's odd for him. But certainly like the decreased wanting to eat in a lab of any kind is like,
Always weird.
what? Yeah, and they were like, and then he just seems sort of lethargic. Like I just sort of feel like he's not like himself in the last couple of days. Really, it's definitely been a little bit worse. And then he had diarrhea all of a sudden. And so we just thought, wow, these things seem to be getting worse. Every time we think like, oh, let's give it another day, it's not getting better. Nothing dramatic, but just like this sort of like, he just ain't doing right. I don't know what's going on. Something's not cool. ADR.
Absolutely.
And so when I kind of heard the history, I was like, okay. I was like, well, I never liked this sort of thing in like a 13-year-old dog, right? I'm always a little bit like, okay, that's not great. And so I went in, did my physical exam, and as I'm feeling his belly, I kind of was like, well, have you guys noticed that he's a little like little tense? Like he looks a little bit sort of like his stomach's a little distended, not stomach, but abdomen's a little distended. And they were like, yeah, we thought so too, especially in the last couple of days. It's really gotten worse. Like, really notice almost like he looks sort of pot bellied. And I was like, yeah. I was like, and then, with me, like, I'll check for like a fluid wave, and I was like, oh, think there's some fluid in there. And they were like, oh, really? Like we thought that, but we thought that was silly. Like we didn't think, and I was like, yeah. And so I was like, well, let's do some imaging. I mean, we'd already had blood work going just because even from the history, I was like, just if they're cool with it, he's lost some weight, like he's not doing right. Like let's just get the blood work going, and then that way it'll be almost done by the time I'm done with my exam.
Yeah.
They were totally fine with that. Great owners. And so taking a look as the blood work was sort of coming up, I saw, well, he wasn't anemic. Um,
Okay.
he did have a little bit of a high white count, and his liver values were high. Um, but that's really it. I mean, it was not a dramatic change in the blood work at all.
Sure.
And some of the changes were sort of like at his age,
That's
not nothing too crazy. The white count was a little bit weird. Um,
good.
and then and we did the imaging, and I mean, he had his spleen was huge.
Yeah.
Um, yeah, and he had fluid in his abdomen. I checked it just to be sure with the ultrasound tube, and I could tell from the X-ray. And then I was like, well, let me just see what this fluid is. So I just quickly tapped him. And what it looked like to me was a fluid that had just recently changed. So like it looked to me like it probably had been that sort of straw colored, clear, like modified transudate sort of thing, which we'll explain in a minute. But it was slightly bloody. So it made me think, well, I wonder if this mass is just starting to bleed. And that's why they saw a big difference. And so, I went in and had the conversation with the owners about what was going on, kind of told them what was happening, gave them the options for, referral, but, euthanasia or just kind of palliative care. Because at this point now, he was still, I mean, they were like, it's not dramatic what's happening. We just know him really well. And
That's,
he doesn't see, you know what I mean? But his pulses were still good. He was not anemic. And I warned them that, hey, I don't know how fast this thing is bleeding. I don't know how quickly this is going to happen. But, sometimes they'll bleed and then they'll stop bleeding. You know what I mean? And so this could go
absolutely.
on for a while. And so I think it's really important, and maybe I'm getting ahead of myself a little bit, but like for me in general practice, I will say that I will see a lot of these guys where people have no idea that there was a tumor. And even times where I have found a tumor incidentally. It's not even really why they came in. Like they came in for another reason. We did x-rays and I was like, "Oh, and PS there's a tumor." You know what I mean? And kind of talk them through like, well, what that could look like if it started to bleed, or if it's going to cause a functional obstruction or something like that, depending on where it is or whatever. Um, and and there are times where I'm not in an emergency, so I'm not usually seeing them when they're down and out. I'm usually seeing them when they're just sort of not doing great. And is there anything we can do because they're not ready for today to be the day that they say
Yeah.
goodbye because it's such a shock. No, I
Well,
have had the other where it's like they are actively bleeding and actively trying to die. And those are really sad because people are usually really shocked by those things.
Nate.
And those usually end in euthanasia, unfortunately.
Yeah.
Um, but yeah, in this case, I did give them the option. I was like, if you want to go to referral, they're gonna probably, they're gonna talk to you about surgery, CT, like all that stuff. I don't, you know what I mean? Like, um, and I was like, but you have to be willing to spend a lot of money and maybe not at the end of it have a different outcome. Um, and in a 13-year-old dog, it's probably a hemangiosarcoma. It's probably a, you know, tumor that's not,
Not great.
it's not benign, most
No,
likely.
most
Um,
time it,
and I warned them too that like, if we did chest x-rays, like that would be like the next thing too. Like if we're really trying to work this up to see if there's something we can do, then, this may have already spread. This may, you know what I mean? And a lot of times
yeah.
from my experience, I don't know if, you work at a, not just an emergency clinic, but you have more that secondary, like specialty stuff.
Yeah.
I'm curious to know from you in this case, like how many people that you see would have gone that next step, because I always try to be really honest with people. Like, even if you do surgery, I mean, most of the time it's like a 2-month prognosis if it's a hemangiosarcoma
Yeah.
in a
So
big
yeah,
dog, in a big dog.
a big dog. Yeah. So usually like I'd say about 3 to 4 months is most time like the prognosis I'll see most of them. So yeah, around that 2 month mark. The I've seen a lot more good case though from time to time. I think they're doing some studies to see like how accurate that actually is. I think
Mm-hmm.
it is the majority of them are hemangiosarcoma.
Mm-hmm.
It's a tough prognosis. Not gonna say it's not when
Mm-hmm.
you get that one back. It's depends on what the owner's goals are. If they're not ready to say goodbye and they're willing to spend, and unfortunately now it's super expensive. We can talk about that on another episode altogether. But it's just it's I think it's getting more prohibitively expensive
Yeah.
to do it because a lot of times they'll need a transfusion first,
Mm-hmm.
and then they might need a second one if they're really big. If they're really big, who knows? Then on top of that, you're then sending them to surgery. So you're at our hospital upwards of like $10,000 to $12,000 for that surgery, knowing that you only have 3 months maybe left with your dog. It's a tough pill to swallow, and I mean, I couldn't do that right now, honestly. It's just expensive.
Mm-hmm.
So it's sad. I
Would
think
you
that's the
though? Like, I guess that's always the thing that I like. I always try to be really honest with people of like, you know, I'm not sure all dogs, like, dogs do tend to recover from surgery amazingly well, right? Like,
oh,
it's a couple of weeks. It's not the whole time that you have with them that they're recovering, which I do think people are scared about because they think like, well, if I had major abdominal surgery, I would not be cool in 2 months. You know what I mean? But dogs will be, you know. But also you have to take into account like not just the expense, but like stress of it on them. You know what I mean? Some dogs like they get super stressed, especially if they go to like a new place or you know what I mean. Now this dog, he was a little bit nervous. I think he would have been okay stress level wise, but like I don't know. Sometimes I look at that and I'm like, that's a lot to put the dog through, a lot of money, and very little time. You know what I mean? Like if it was a year, I think that's a different conversation to me. I mean, everyone's different. You know what I mean? But that
yeah.
wouldn't work for me.
I used to be like when I lived in Chicago and I worked out there. A lot more people said no, and I would have been the same camp.
Mm-hmm.
Now that I've been out here doing it long enough, like I got a lot of people that say yes, and every once in a while you get to be one of those 30%ers that get a good prognosis, which is
Yeah.
great when that happens. Yeah, I would do it for Loki. 'Cause he's also a good dog in hospital. I think you're very much right. Like, even
Right.
until your dog is in hospital, the surgery itself doesn't bother me. It's such a quick procedure. It doesn't
Oh, it's
go
not
into
that big. It sounds like a much scarier surgery
yeah.
than it is.
Yeah.
Because you're also right. Like, I, I mean, I don't know. I know like what they would do here. Like, usually they're gonna do a CT. They're gonna, you know what I mean? They need to do surgical planning. They have to know like where the tumor is, what it's attached to, if there's other things. You know what I mean? Like, they're gonna work up to make sure that it hasn't already spread. Like, there's other things they're gonna do beforehand, and I think that's so overwhelming to people because they're like, wait, it's not just a quick like we go in, we do the surgery, we're done. Like there's a whole lead up to it, and
It
then there's
depends.
the surgery.
It depends if it's like liver based or a spleen. If it's just a spleen and they do like a quick ultrasound, they can be like, hey, it's just a spleen. If we don't need a CT, they go right to surgery and it is a quicker operation. If it's a CT, then or it's a liver based mass,
Yeah.
then a lot of times they'll want to see like is it resectable or removable in the first
Hmm.
place, so the CT scan, and then following that part will be whether or not they go to surgery.
I think I'm wondering if it's somewhat institution dependent too, and like surgeon dependent, because I feel like that would be depending on where I sent them. There's some places that definitely jump on the CT a lot faster than like I feel like Purdue is pretty. Maybe I'm wrong. I mean, maybe
No,
I'm.
no,
That's
and
been
you're
my
right.
experience when I sent them.
And you're right for a lot of reasons because one, CTs now have become, depending on where you're at, not as expensive. Like a lot of times you'll do an ultrasound for 700 to 800, and then the CT is like 1,000, but you also get a lot more information, or like
Right.
1,200 sometimes. So like
Mhm.
you get a lot more information. You can take chest X-ray anyway, so that's another
Right.
$3 or $4. You get them ready for surgery, so you can just throw them to the CT real quick under anesthesia, and if it all looks good, you go straight to surgery. So there are a lot of benefits to doing that.
Right.
I think the place where just the ultrasonographers we have, they're I'm very blessed. They're incredible. I think it's one of the smartest people I've ever met, honestly. So
Hmm.
they find things that are just insane. I'm just like,
So probably they feel a little more comfortable just doing it off of ultrasound versus
yeah, like
CT. Hmm.
yeah, the people that we're going just very blessed with. So I think that's part of the reason why. But they'll do CT. So if it's liver mass, they're going CT
Yeah.
almost. So
Yeah. Well, I've
or they
definitely seen that with the liver masses. And it was an interesting thing too because like I did once have like a little dog that had a really similar thing. And it was when I was a younger vet, so I just had sort of this like one idea of like what a splenic mass meant. and
Right.
they ended up going to referral, and the surgeon called me and was like, yeah, actually for these small dogs it's much more likely to be benign, so for the smaller guys, like, the surgery is generally going to have a better outcome than the bigger guys. And I've had a few of the bigger guys too where they've sent off the mass after surgery. It came back as a hemangioma, but then they still ended up having something happen down the line. So
Yeah,
that's a tricky one for me too.
yeah, and it really, they get that. I think at the end of the day, I know what the owner's goals are.
Mm-hmm.
Uh, willing to. It sounds bad, but I literally tell them like it's an investment. You're investing in either 3 months potentially, and you might get lucky with a longer term investment, but expect about 3 months.
Yeah.
And if you can spend 12 grand and get away and you're fine with it, great.
Yeah.
But not always 12 grand, depends on where you're at, and it's in a very expensive area. But
Around
um,
me, it's probably more like 7.
7, okay, yeah. So um, it's expensive. And it's sad that we have to give owners that choice, and honestly, that's part of the reason we're doing what we're doing. But it's important for you to know the prognosis of it and make sure you have that conversation before you even get referred.
Mm-hmm.
Sometimes that's one of the big things I think I see is that conversation is not being had beforehand, and then it turns into a transfer to euthanize conversation.
Oh, yeah. No,
Those are
I always have that conversation every
that's why I
time.
like to use mine. That's why I'd work with you. Okay.
Yeah, I know.
So
If the transfer wasn't, across many states. Um,
you gotta go to California.
yeah.
But the nice thing is just because you have flu in your abdomen, it's not always blood, which
Oh, yeah.
is
Yeah.
so. Just because there's the doctor tells you there's flu in the abdomen, it doesn't mean it's always blood. There's a lot of other options, and maybe
Hmm.
you can go and like start with some of the ones you see.
Yeah. So, some of the ones that when I see, I kind of, I'm like, oh, okay, this isn't what I was thinking. Every once in a while, if it's like a chylous effusion, which is this like kind of milky effusion.
Yeah,
Um, there, that's not, well, I suppose you can have a chylous effusion because of cancer, but usually it's not because of cancer. Um,
depends on what cavity you're getting, like the chest or the abdomen you're getting out of, and
yeah,
also a lot of times like sometimes you get mass obstructing your
right.
lymphatic system, and
Right.
that's
That's why I was like, let me caveat this for just a second, because but they can be idiopathic. Like you can just have chylous effusion and it can be fixed, and
yep,
it can also be drained several times. And actually, I mean, and I've had that type of effusion in the chest and in the abdomen. Obviously today we're just talking about ascites. So that's just that the abdominal cavity. We're not talking about, we can talk about that another day.
yeah,
All of your cavities can have effusions in them, sort of fluid. But like I've had a couple where people go and have that totally worked up. But then I've had also two ones where they didn't, and we were able to sort of drain the fluid and get months in between draining the fluid. You know what I mean? Now,
yeah,
eventually it will come to a point where you can't keep draining it. Either you can't get good pockets or there's just a lot of scar tissue that happens because of it. Um,
yeah.
but it's still, you can palliate and find and buy time. So it's not necessarily like, oh, they come in, they have a big bill of fluid, and that means, it's the end. A lot of times you do have a couple of choices and they can be fairly favorable ones.
Yeah, exactly. And a lot of times we just classify those fluids by we call them like a transite or an exudate, just depending on the number of cells
Mm-hmm.
that they have in them. But at the end of the day, there's probably the major fluid you can have is yes, blood is probably one of the big ones. Chylus, the one you just referenced, can be a fluid in there. Something we call serosanguinous, which is kind of just like a pink tinge fluid. It's got some blood cells in it, but it's not necessarily fully blood. It's a lot of times like something oozing most
Yeah.
of the time.
That's what I
Uh,
think was sort of happening with the one that I saw the other day. It was like clearly had been one of the ones like you were just mentioning.
yeah,
Um, but then it looks like there was some blood coming into it. So it was like not a full on hemoabdomen, but
yeah,
definitely I think that that tumor was starting to bleed a little bit. And the
yeah.
question is like, was it just going to bleed and bleed and bleed? Or was it going to bleed and then stop? And then he was going to have a couple of weeks of like running around and being fine. And then, you know what I mean? Which they do.
It happens all the time.
Yeah.
The owners like want to call back the clinic and be like, "You told me my dog would die tonight," or like, "You got lucky and like stop bleeding, it's gonna bleed again." Like it's,
Yeah.
so it
Doesn't
does.
take the mass away. I showed you the
It does
mass. Like, it's
still there.
there.
Promise. Um,
But the thing that's funny is like I do always tell people I'm like because they're like, well, how long? And I'm like, okay, I'm gonna say I think weeks,
and
not months to years, like weeks to months, but not probably months. Like in this case, I'm thinking weeks. But I was like, but if I could be wrong about anything, that's what I want to be wrong about. Like I want you to like be like, he's still doing great. You know what I mean? And that great. I want to be wrong about that. You know what I mean? So
yeah,
that's I always tell people that because
yeah, I
I
can
have
understand
had it
it's
happen.
a time bomb. It's a time bomb that you can't see the time on, unfortunately, and go off at any time, and it's unfortunate because I think the number one for at least the hemo abdomen or the blood in the abdomen ones, it's always like they're doing great, they're doing great, they're doing great until they're not.
Until they're not. Yeah.
It's like within a 6 hour span, they'll go from doing great to not doing great. Like the owner's always like, yeah, we were playing fetch with the ball this morning, they're doing awesome, and all of a sudden, like now they just don't move. Um, that's probably the most common presentation for that one.
Yeah.
The other ones I'd say that
And the thing too about that though is like at least if you know they have the mass, you know why it's happening. You've kind of
yeah,
explained to them like, hey, just let him be a dog, you know, and enjoy the time that you have. Let's palliate him. He's a little uncomfortable in his belly, but like,
sure,
you know what I mean? But otherwise just like enjoy him because this will be the thing that this will be what happen, you know, this will be sort of be what takes him from us. But like until that time, let him be a dog. But at
yeah,
least they know what to expect when you explain, like, this may happen or this may happen, and this is what to watch for. It's the ones that had no idea that were playing that morning, and then they come in and it's like full on hemo abdomen. You're just like, oh,
those are the tough conversations.
yeah,
I'd say the only ones that ever present that quickly would be heart failure situations, right-sided heart failure.
yeah.
Those will kind of sometimes pop
But
up a
those
little.
won't be hemo abdomens. Let's just
No,
be
those will
clear.
not be hemo.
That's
Those are
not
just
going to be blood in the abdomen. That is fluid in the abdomen, but it is not
usually
blood.
watery. But yes, it's or no, it's not usually water. It's protein. Sorry, protein related. But yes, so fluid in the abdomen. So yeah, heart failure is probably one pops in pretty quick. Those are probably the two big ones that pop up like more suddenly. Sometimes if you have really, 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 really low protein in your blood, those ones can. The owners always say like they weren't that fat earlier in the week and now they're very chunky and they
Yeah.
don't know why.
Yeah,
Uh,
I had a weird one like that where it was just like we dog was fine, and then all of a sudden I was like, wait, why is there a belly full of fluid? And it was just like an idiopathic protein. It was just like a weird like protein lose like, but it wasn't a clear cut. You know what I mean? Like so we figured out it
yeah.
was like autoimmune in the end.
Oh,
It was just but it was really weird, like the way
yeah.
it presented. Yeah, because it took like it wasn't you would think that the protein would have been so much lower for the amount
Yeah.
of ascites that this dog had. And it, I was like, oh, it was weird. It was a very weird thing. It ended up
Not
going to
bad.
Purdue. Yeah. I see it in the beginning, right? So, and then
Yeah.
they kind of finished the workup. So I can't speak eloquently on that one, but it was odd, but the dog's doing great now. So,
Oh, that's good. That's the whole point. That's
yeah.
why we refer things out. That's why I send to specialists myself. I'm like, hey,
Hmm.
I'll keep you alive overnight, and then I have some very smart people you can talk to in the morning.
Yeah. Yeah. Well, they can do a little bit more stuff that I can't quite do. So here you go.
Yes,
Go to Purdue.
I did. But
But
yes,
but those types of ones have pretty happy endings, right? I mean, like there's something you can do about that, and you can do something about it for like a while. It's not, you know what I mean? It's not
yeah, I would say protein losing enteropathy. So where you're losing protein from your GI tract.
right.
Sometimes those can be very progressive and ugly, just because of the nature of things. Sometimes you get under control, but I've seen a couple cases where they can more poor prognosis. But I'll say that protein losing nephropathy is the ones that you're losing protein from your urinary system, essentially. Those usually are typically better because you can control, like, at least give some medications to help control the amount of protein you're losing from your kidneys. So those typically have a little bit better, in my opinion. But yeah, every once in a while,
Those I feel like you can manage those chronically for years and years with the kidneys, but you're not going to get ascites from a protein losing nephropathy.
no, actually, you're not. Sorry. Well,
I've
you
never
can.
seen that. You can? I didn't even know that.
Yeah, because you're still losing protein. You're trying to figure out why you're losing protein. So a lot of times you'll have
Oh,
low
I guess
protein.
if it gets low enough, then it doesn't really matter. If
Yeah.
it's where it's
It's
getting
not
lost
usual
from.
for it to get that low without you seeing like other symptoms
Yeah, I
first.
was gonna say
Uh,
maybe I've just never seen it because we've caught it
yeah.
well before that.
Usually, yes, you're right. 100% you catch it before, but that'd be one of the reasons you would have. Yeah, one of the reasons you could. But I've seen it a couple times, but usually it's, I'm not saying negligent cases. It's things like they just weren't noticing before about other symptoms that maybe should have been like, oh, this is weird.
Right. But yeah, no, I guess maybe I've gotten lucky with my protein losing enteropathies. They've responded really well to treatment for long periods of time. So
Most of them do. There's just a few.
yeah.
Usually Yorkie with like a
Oh
concurrent like,
yeah.
mutation too. Like
Yeah.
they have a combination. It's the Yorkies usually just don't. They're poor little creatures. Honestly, we need to do a podcast about Yorkies. We did one about Frenchies. We need to do one about Yorkies, and like they're cute little dogs when they're like 3 or 4, but they do not age well, and they have so many diseases that
They
it's not.
do. They
Um,
do. I think it's one of those things like you got to be really careful where you get them from because just genetically they're so predisposed to so many things and they don't age well. You're right. I and the thing that's funny is they live really long, but they don't age well.
no, it's not like a happy aging process.
No.
It's rough, and
And there
one of
are
my friends.
exceptions. There are exceptions. We're not that okay. There can be exceptions.
There's a few, and they're
Yeah.
endearing, so they're always cute to the owner's eye, but they just have some aging things. But my friend lost his family's Chihuahua the other day, and they called me about it. And their family is like they might get a dog because like they're just not used to having a dog in the house. And we should do a podcast on like I don't know if we've done about just like adopting the right dog. I think we've mentioned it.
I think we've talked to. I'm gonna go
Then
back.
we
I actually just like re-looked at all of our podcasts to see,
yeah
and then but I can't remember because I do there we did something like that, but I don't think we ever did. I don't know. I'll have to go back and see.
yeah
Now
we've checked it.
it's been a while.
Yeah, it's now that we've done almost 2 years with the podcast, it's
Yeah, right, exactly.
a bit. But yeah, regardless, food in the abdomen. Uh, it doesn't always have to be like a death sentence necessarily. It can be positive things too. It's just you gotta make sure you get looked at sooner rather than later.
I mean, I'm gonna say in my experience, it's usually not good.
It's usually like right sided. Oh yeah, it's like right side heart failure.
Yeah.
It's very manageable because it's not like left side where it's gonna like cause them to a lot of times have respiratory distress right away.
Right.
Manage with medications. You will be going back to
Yes.
the hospital frequently because they look like a little pot-bellied pig so often. Especially if the medications aren't appropriate at that time. But
Mhm.
right side heart failure, you can get some time out of. The protein losing ones we talked about, you can usually get time out of.
The
The
pilus
one,
diffusion you can usually get time out of. It's really the
um,
hemo abdomen's the hardest one because that's generally the one that's going to be the most truncated time I think that you get
yeah, or the cancer related ones like carcinomatosis, where you have more sanguineous one. Like, I mean, it's
Mhm.
just cancer everywhere in your abdomen.
everywhere. Hmm.
That's a bad sign. It's usually why your dog's like not eating well and stuff like that. They're usually not as rotund. They're just like free fluid in the abdomen. But
Yeah.
I see it a lot more in cats. I think like the cats because they don't
Hmm.
look. They already kind of have that pupa, once
Yeah.
just like that pudgy part, so you can't
Hmm.
really tell like are you just chunky or are you actually have fluid there. So a lot of times
Yeah.
you'll see those ones and you'll be like, oh, there's fluid here that wasn't there, but we couldn't tell because you're a cat and you hide things really well.
Right, right, right. Yeah. Yeah, that's an ugly one for sure. And it's hard I guess too. Um because I think you're right. And sometimes though, I probably the again, it's sometimes just like what you see, right? Because
Mm.
when I've seen right-sided heart failure, it's a lot of times been cave syndrome, and like so like they had heartworm disease, and like they never
Oh,
treated
good point.
it, and so there was no going back with that.
That's a good point. I don't see heartworm disease pretty much at
Yeah,
all. Uh,
right.
it's kind of funny that you mentioned that. So yeah,
Yeah.
that's a good point. I don't see that as much, and so for me, when I see right side, it's usually more genetic related, and
Yeah, yeah, exactly. And so I think because like I had a cat that had I want to yeah, I had a cat that had ascites and then went to the cardiologist and did great for like a few years. You know what I mean? Like just had to get on the right meds and whatever else. So like yeah, I have seen it be good, but yeah, I don't see a lot of right-sided heart failure. Usually when I see ascites, it's one of the other things. So
yeah.
the like my you get informed somewhat by the ones you've seen, and cave syndrome was probably one of the most dramatic things I've ever seen. And we could talk about that another day too, heartworm disease. But
Wait, what? We talked about heartworm disease?
we've talked about fleas and we've talked about ticks, but we've never talked about heartworm disease, which we probably
Yeah.
should.
Yeah,
That's a good
heartworm
one
probably
to
won't
talk
talk
about.
about. Also,
Yeah.
parasites. I don't know if you've ever done like parasite episodes. I will be trash on that one, but it's talk about because I'm like, it's
I
a
mean, we
parasite.
should probably talk about parasites too. Look at us just coming up with a whole bunch of things that you can listen to down the line. So
That's
yeah, but that's dramatic, especially in people who sort of don't believe that heartworm disease exists, and then you are like, well, your heart dog's in like literally heart failure because of the amount of worms in its heart and blocking things and causing fluid in the abdomen, and so yeah,
it. I think
that
that
was probably one of the most heartbreaking. It was a really sweet boxer, and it was just really sad.
boxers.
Yeah,
It's just good dogs.
yeah,
Didn't have heart problems and seizures
and mast cell tumors.
and mesotumors. They'd be great dogs. Bloody fantastic. They're good
But
dogs.
don't you feel like, see, this is what my kids say every time they are like, "We want this dog," and I'm like, "Oh," and then I like list the things. They're like, "You're the worst. Why? Why are you a vet? You know all the bad things." It's like, I'm sorry.
But the thing is, there's no dog that doesn't have that.
That's
Like,
100% true. It's just it's
yeah,
the thing you decide to deal with, right? I mean, like, like I knew getting a lab, I was like, okay, so I'll probably have to fix an ACL at some point. And he's gonna have allergies. So
you're
I'm
probably
just
a
gonna
foreign
deal with that.
body if
What?
you're in a foreign body, most likely because they are
Oh
notorious.
yeah, I'm sorry. Yes, a foreign
Then
body. But like I have had that fund ready for the day that I had to. And generally he throws up the socks, so I haven't had to go in and retrieve one yet.
yes,
And he is almost 4, so I'm hoping maybe we're passing that part. But now we're getting into clear ACL territory. So now I'm like, all right, now I got to bulk up that fund a little bit for when I have to get him a TPLO. And then for the next year when I have to get him the other side, because that's probably going to happen. And then down the line, we've got Larpar and I don't know, Addison. So we'll just wait and see when he, and then PS allergies all the way. But like for me, that was like I was like, okay, fine, I can deal with all those things. You know what I mean? Like, I think it's just like being prepared for what you have to deal with. Like, I don't have a Frenchie right now because the airway surgery into all the other things like that are just way more
yeah,
expensive. I'm like, I just can't do it right now, even though I love them.
I'm the same boat. Got to like, so I like huskies. Health-wise, they're not terrible. There's idiots, and really,
Yeah.
I mean, you tolerate the personality, it's fine.
You can deal with most of the other things.
You do most of the other things, so it's besides Black Colin, Loki's
Yeah,
already lost a lot, so he's fine. So really,
exactly.
he's fine. Anyway, well, I digress. The
Well, so
point is,
yes, we sure did. But anyway.
oh God,
So ascites, but if you people do have any other questions for us, we're always happy to kind of delve into things deeper. But yeah, if you are seeing those weird signs, and I have had lots of people who are just like they're vague signs. They're not so trust your spidey sense. If you're like,
mm,
my dog is not eating as much, and I kind of think maybe he's breathing a little harder or his belly is a little rounder, go bring him to the vet. I would
yeah,
so much rather be like, no, this is totally fine. He just gained a pound. He's just fat. You know what I mean? Like, I would love for that to be the answer. It makes all of our day when people come in worried and we can tell them there's nothing. But you're much better off to
mhm,
come in case it's something. And so in the case of this dog, they're now prepared. They know they have the choice to go to referral. They didn't choose that, but that's fine.
yeah.
And so what we did was we offered pain meds, and I don't know if you ever use the Chinese supplement. I'm gonna
Oh,
say it
Union
wrong.
Bio,
I
Union
didn't
Bio.
say it. I don't say it wrong. Okay, good. I was like, oh, I'm gonna say it out loud. So I happened to have a whole bunch of it that was donated from another dog, and I said, hey, give this a try. Let's see if this stops the bleeding for a little while. It's not harmful in any way. I do think it's worked. I've used it in dogs with nasal tumors when they've bled, and it's helped a little bit.
I think it does have some it does play like some benefits.
Yeah,
So yeah, I prescribe it for anything that's bleeding
yeah.
to use them out.
Yeah, yeah. So anyway, it's a Chinese supplement that helps with hemostasis or helps to stop bleeding.
Mhm.
It won't work forever, but it can give you some extra time. And so in this case with this dog, that's what we did. And just give him some extra time with him. So they weren't really ready to say goodbye at that point, and nor did I think they needed to. He was stable. So he went home, and hopefully they'll get. Hopefully I'm wrong, and they get months.
That's the hope. That's always the hope.
Hmm.
So, but yeah, if you have more questions about ascites or any other random topics we touched on during this episode, feel free to jump in. Send us an email to podcast@mybalto.com, and we'll be happy to answer them for you. We had our first list, or not our first, but like one of our listener questions last week, but that was probably our first podcast, only one focused on the listener.
Yeah, just the whole thing. Yeah, yeah, yeah. Because
Yeah.
we've had a couple of other ones before, but that was like the whole devoted
Yeah, that was
podcast.
the
The
first one
first time,
devoted to
yeah,
it.
yeah,
Yeah,
yeah.
this
We've
is more
answered them
about
here and there, but yeah,
yeah, exactly. This was all that worked out. So I'm gonna like to do more of that for you guys too. So feel free to
yeah.
hop in, ask questions, and let us know your thoughts.
And thanks again for listening. This has been the Pause It Podcast.